Assalamu alaikum, bismillah. And so people who work with me know that I'm very candid and very direct. So I'm going to kind of share with you guys that this has been a tough year. This has been a tougher year for everybody. And I think everybody knows that. And it's been tough years for us as organizers. We were functioning at kind of 25% capacity. I'll be very honest, this is the only conference I attended. Normally I attend and participate and talk at 3 or 4 conferences at least a year. I canceled all of my conferences except for this one. And so the inside joke Bumi and I have had is that our fingers are on the nuclear option, which is to cancel the conference. And I had texted her and said, I'm glad we didn't deploy the nuclear option. It's going actually well. And I say that to talk about the importance of the team. And it's not 1 or 2 people, it's the team. And there's no way any one of us could have pulled this off. And quite frankly, if one more of us dropped out, I don't think this conference would have happened. And so that's a theme that came out of not just the organization of this conference, but also some of the talks. What struck me, one of the things that struck me, it was a very powerful talk by Dr. Naveen Razakallah on survivors of torture. And it's a very difficult topic. It's a very difficult topic to hear, and it's an even more difficult topic to research. As you can imagine, these are Syrian survivors of torture who go into a lot of depth. And this is a senior, talented clinician who's also a very talented researcher. She said that she could not touch her work. She could not work on her work until she recruited a team to help her through it. And that really struck me as a senior person. When I started off my session in managing mentors and focused on team efforts, I'm thinking about junior people recruiting a team of mentors. But even for senior people, we all know that we need the team to get us going. So that's one theme that I wanted to share from my observations of this conference. The other theme for me, the second one, is the kind of the sophistication. I've been doing, participating in this conference since the get-go, and the sophistication of the methods being used and presented and the work. There's a couple kind of types of work that's shared. One is the very important service programs and teaching programs. And so, for instance, I attended the M.P.H talk about their first aid program. That first aid program has made a huge impact. They've touched so many lives and just training the people who are using first aid or who are training people in first aid so that they can help out. It's called, in health service research, we call it a force multiplier. In other words, you train people who are going to help more people. So you're multiplying your effect. So M.P.H has done an outstanding job. And a lot of other organizations shared their work that are doing very innovative and important work. And it really invigorates us. It really inspires us and energizes us every year when we hear the important work that's being doing. What's been I'm very pleased about is people are documenting their work more. So in other words, not just sharing their work, but also doing the program evaluation and sharing the research in the academic literature and in the general literature. And so that's an example of that was Batul, can't say her last name, Aluka, was sharing her work in the mosque space of the kind of qualitative research in mental health counseling and the role of imams in that space. And that's kind of a combination of talking about demonstrating service through research. And so I'm hoping to see more of that in the coming years of not just presenting research, but also describing services, innovative services through research. And that comes back to the team issue. And so the team issue, the way I like to think about it is vertical collaborations, mentees finding mentors or mentors finding mentees, which I hope continues to happen in this conference, and also horizontal collaborations. I've certainly benefited and have engaged in many collaborations over the years from this conference with colleagues. And horizontal collaborations also occurs among trainees. And so I'd like to see more trainees work together and share data, especially internationally, because now we're seeing many more people from Indonesia, Malaysia, Europe, the Arab world, Turkey, attend the conference. And there's an opportunity for you guys to work together and collaborate. My final comment is about our keynote, Dr. Amina Matthews. So she brought a very interesting perspective. I mean, in addition to the important anti-violence and anti-racism work she does, her bringing up the social, ecological, political dimension to mental health and community psychology is very important. And just underscoring that, I felt was very important for us to share. So I'm going to stop there and go to give the floor to Bumi to expand or share her comments.
Yeah, thank you. Assalamu alaikum, everyone. I have to echo what Hamada said. We have joked about the nuclear option, and I'm so glad it didn't happen. I actually, after going to the sessions today, have just felt energized and just setting new intentions for what it means for me and my work forward. I was just messaging a friend who was serving as a discussant, and she was talking about how it's re-energizing her to do the work that she set out to do when she embarked on the PhD. So I just want to thank you all for giving such insightful presentations and also for asking insightful questions from the audience. The first session I attended was just so striking to me. I couldn't even formulate a question because the speakers did such a great job of engaging each other in their work. They had never met each other. And this was the Liberation Psychology panel. They had never met each other, but asked questions of one another about their work. And we're constantly saying how it was just a great synergy. And so I think that this, having this conference really speaks to the fact that the space is needed, these opportunities to connect. And there was and there's just these reminders about that connect to this theme about the type of work that we need to do in the context in which we're in. So I really appreciated the critical conversations that were had, calling attentions to oppression, racism, misogyny. Everything was so insightful. And I also want to echo that a highlight for me was Dr. Amina Matthews, who reminded us of the importance of organizing. I love how she addressed that question about what can I do as a college student, and reminding us that, much of the change that has happened in the society has come from college-age people, right? Reminding us of Fred Hampton. He was a college-age person, right? Doing the work that he did. So learning lessons from history to address social problems, as well as reminding us to take care of ourselves while doing this work. So I do hope that you all again join us tomorrow. We have a full day planned of insightful sessions. Thank you all again for being here.
I will add a quick comment here. First of all, I'm the one with the nuclear code. How are you two deciding to nuke? And for me, I'm not the one to give up. That's something, but I do want to make a comment that this is exactly the vision we all had, to have a community safe place where we could tackle some of the very hard issues that we heard today, from women mental health to safety to impact of racism, health equity, and torture. But this is our place, our space. And I'll just end on one remark, that this conference is as strong as each one of you. So please continue to come back, continue to bring your work, continue to collaborate, communicate, and grow together. So thank you. Very, very fulfilling, and alhamdulillah, an amazing experience today. And hopefully we can build on it tomorrow. So thank you again, and a shout out to the volunteers. Great work. Thank you.
Thank you, everyone. I just wanted to give a quick reminder that we do have a Narratives of Pain event at 6 o'clock Eastern Standard Time. So in 2 hours, I just sent you the link. Feel free to register using that link. It's not an open Zoom link, it's closed, so you will need to register if you would like to attend Narratives of Pain. And what Narratives of Pain is it's just a storytelling showcase where community members gather for about an hour and a half to 2 hours and just create a restorative healing process while everyone shares their stories. Inshallah, we'll see you there. Otherwise, we will see you bright and early tomorrow morning. Jazakallah khair, everyone. Assalamu alaikum.
Thank you.